Hello, my name is Amalin Pasca. I'm a fourth year medical student from Bond Uni, and I've been at the TBC clinic for about 5 weeks, and it's a very interesting experience because you get to see a wide range of psychiatric cases ranging from schizophrenia all the way through to depression, bipolar. So you see a wide range of cases, and it's a good experience so far. The lectures are very good. It's pretty much the same lectures that Dr. Bunting gives us, but it's a good way to review the lectures because sometimes there are certain components or certain things that you don't understand during the lecture, and it's a good resource to go back and review. So it's very good because it's got all the content in there, and it's got some interactive stuff in there as well, which helps with the learning. You could use it for revision purposes, studying just before exams, and just to help with the understanding, use it for writing reports. And I think you can put it on your iPod as well, so you can listen to it whenever, on the go, I guess, basically. So it's very flexible. Yeah, with regard to the cases, they're quite useful because sometimes in the clinic you don't get to see a certain condition, whereas when you look at the cases, you see the conditions and it gives you a wide variety of the same case. Because it could show you one case of depression, but it could show different types of depression on the cases. So it's not just one thing, it just shows a variety of things. And there's a lot more to it on the cases. Because sometimes you don't see much because lack of clinicians. And during those times you might go onto the computer, have a look at these cases, and by that you're actually learning because you're actually looking at real cases. Guidelines are very helpful because they're used for diagnosis, and that's one of the things that certain guidelines we need to know as medical students, and it would be very good to have a copy of those because that's what you learn. So having that would be very helpful. In the clinical workplace, you might not have all the time to go through the full psychiatric history, and those screening questions give you a quick grasp of how to interview a patient within a limited time. So they're actually very helpful because you can pretty much do a psych history in about a fairly thorough psych history in about 10 minutes, getting all of the relevant information. And those questions are very relevant clinically.